Hey everyone, welcome back, or if you're just joining us, welcome to KSSP Podcast. I'm Spencer.
And I'm Katie. Today we're going to discuss marijuana, cannabis. So, first we're going to look at this image of it says marijuana's effects on the brain from Desert Cove recovery. And when many people smoke marijuana with THC, the lungs into the bloodstream. Many people may feel a heightened sensory perception, euphoria, relaxation, increased appetite, and an altered perception of time, which usually time ends up going really slowly. And then some people's effects are highly adverse and can include fear, distrust, or panic. And for cannabis, the typical routes of administration, there's a lot of them. I can't even list anywhere close to all of them right now, but main ones would include smoking, vaporizing, an oral route, which would be edibles or THC capsules, and then tinctures and topicals. Those would be the primary ones.
And then we'll go into a little bit of, the pharmacology of cannabinoids with marijuana. So, they have high lipid solubility, which is why they can persist in the body for long periods of time. And THC can be found in the body for weeks or longer. Investigators have suggested that this is an important factor in marijuana's effects, perhaps because cannabinoids may accumulate in the body, particularly in the lipid membranes of neurons. THC exerts its most prominent effects via the CB1 receptor and the CB2 receptor, which are G protein coupled receptors. THC appears to alter mood and cognition through its agonist actions on the CB1 receptors. Via CB1 receptor activation, THC indirectly increases dopamine release and produces psychotropic effects. CBD also acts as an allosteric modulator of the mu and delta opioid receptors. So, two of the opioid receptors. THC also potentiates the effects of the glycine receptors. And CBD can inhibit or induce the activity of cytochrome P450, which is a family of liver enzyme isoforms that the body uses to metabolize some prescription medications, which can end up increasing or decreasing the effect of these medications.
Yeah, so next we're going to list some possible side effects, some negative ones. There can be headache, dry mouth and dry eyes, lightheadedness and dizziness, nausea and vomiting, fatigue, drowsiness, disorientation, increased heart rate, increased appetite, and then hallucinations, and it can impair attention, judgment, and coordination. And we're going to look at some of this article by the NIH. Another one from them. So some short-term effects on the brain include altered senses, altered sense of time, changes in your mood, impaired body movement, difficulty with thinking and problem solving, impaired memory, hallucinations, delusions, psychosis, which the psychosis is a pretty rare risk, but it is a risk for some people. And it just depends on your genetics. Let's see. And then there's been a rise in marijuana's THC levels. The amount of THC in marijuana has been increasing steadily over the past few decades. And for a person who's new to marijuana use, this may mean an exposure to higher THC levels with a greater chance of a harmful reaction. Higher THC levels may explain the rise in emergency room visits involving marijuana use. So the So the popularity of edibles increases the chance of harmful reactions because they take longer to digest and produce a high. And people may consume more to feel the effects faster, and that can lead to dangerous results. And it can also lead to a higher rate of addiction. Like, although it is fairly low risk for addiction, but it is still possible to become addicted. And then there's physical effects like breathing problems, increased heart rate, problems with child development during or after pregnancy. Let's see. I kind of want to read more about this one because I'll be honest, everyone I've ever talked to who did smoke marijuana during a pregnancy never had complications with their kids. That doesn't mean it doesn't happen, but that's just what I've experienced. So this says it's linked to a lower birth weight and an increased risk of both brain and behavioral problems. This is according to the NIH, though. So other research suggests an increased risk of preterm births, but more research is needed. But yeah, everyone, I mean, I guess this kind of contradicts my experience, but that's what the data says, so. And I'm not encouraging people to smoke THC when they're pregnant or anything like that. That's not what I'm trying to say here, but yeah, that's just what I've noticed. And then can be intense nausea and vomiting. And there's been, of course, with the new vapes, there's been serious lung illnesses associated with the vaping of THC. Yeah, I mean, I don't agree with this whole article, honestly. Like, it talks about how it's not good for people with any kind of mental illness. But, like, that's really going to depend on what the mental illness is, if it can be medicinally used or not. Like, for example, it's medicinally used for, like, PTSD, for example. And it tends to have good results in most people. And then we're going to talk about if cannabis really impacts memory. Because I find it kind of interesting about how THC interacts with memory. So there is evidence showing cannabis intoxication can change or distort short-term memory processing temporarily. And it seems to be caused by neural receptors responsible for memory that are disrupted by compounds in cannabis. The ability to learn, loss of interest, or problems with concentration have been shown to be linked to this interruption of short-term memory. However, cannabis has been shown to have a positive impact on neurodegenerative diseases such as Alzheimer's, Huntington chorea, and epilepsy by positively impacting patients' memory. Researchers studying mainly animals have found that it could slow or even prevent these diseases by creating neurons. And then recent discoveries show that we can't say that cannabis itself causes psychosis or that it is detrimental to memory. Other factors include the type of cannabis, the compounds it contains, that may indicate specific risks or benefits, for sure. So how the plant is bred, basically, and what compounds it contains. And additionally, it's hard to factor in the results for people participating in the studies who also use other substances such as alcohol, which does cause memory damage. And more frequent use of cannabis may also cause long-term memory issues. The more frequent the cannabis use, the more likely it is to impact your memory. However, these effects are completely reversible once someone stops using cannabis and can be reversed rather quickly. So experimenting with cannabis should have very little impact, if at all, on your memory. It's the more frequent use when it is through more frequent use when we see memory issues. However, while this may be a risk, oftentimes medical cannabis use benefits outweigh the risks. So that was our episode on cannabis. And our next episode is going to be going over hallucinogens and psychedelics. So make sure you join us for that if you're interested.
And as always, you can leave a comment below if you have any topics that you want to hear us talk about in future episodes.
You can reach out to us on Facebook, YouTube, Instagram, Twitter, or TikTok, and we occasionally do Twitch live streams, so follow us there to be notified.
And don't forget to give this video a like, as well as follow or subscribe to our other social media accounts and turn on notifications so that you get notified when our new content comes out. Otherwise, we will see you all in the next video.